1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now, here's your host, Paul White.
Good morning and welcome to Health Matters with the Medicine Center Pharmacy. I'm pharmacist Paul White. We're glad you joined us. Before we begin, I'd like to thank our sponsors, Altman Health Systems, Studio Arts and Glass, and Genier Appraisals and Liquidations. Today, Brad and I are broadcasting from our administrative offices. Today, our show is all about you. We have an exciting new program to share with our listeners today, as well as responses to questions our friends and neighbors posted on our Facebook pages.
Okay, good morning. You've probably watched a commercial for Single Care and watched Martin Sheen as he entertainingly helps someone save money on a prescription. After all, who doesn't want to save money on prescriptions? If you've used Single Care or GoodRx to help you save money on prescriptions, you know it isn't always easy. You've got to go to their website. You've either got to print out a coupon or save it to your phone to show your pharmacist. And you might not know, too, you've got to expose all your personal information, which they've recently gotten their hand slapped for by not telling you about that. But maybe if you're even more ambitious, you can join their programs and pay a fee and save even more. So wouldn't it be nice to just simply trust your pharmacist to offer you the lowest price available? Today, we're going to talk about a simple, easy way to save you money at your local medicine center pharmacy. You don't have to spend time visiting a website, printing out coupons, hoping to save them to your phone and, hoping your pharmacy is going to accept them. You simply talk to one of our friendly staff members and if there's a better price, just ask us and we'll check it out for you. It's that easy. Just a friendly reminder that all our programs are available on our podcast. You could just look for them in your favorite podcast app, search for Health Matters with the Medicine Center Pharmacy, and please subscribe.
Okay, friends, Brad and I have been pharmacists for over 50 years. Actually, it's probably over 60 now. And it seems like more of our friends and neighbors are taking prescriptions more than ever before.
You are right. I think the national statistics I recently read said that 66% of the U.S. population takes at least one prescription medication. And many, on average, over the age of 65, take more than 4 prescriptions a day.
So I worry about the folks who are struggling to pay for their medications.
On a daily basis, we get questions from patients on how can they save money on their prescriptions? Generally what we see in the pharmacy when we talk to patients is if they have an expensive copay or an expensive prescription, generally the patients do their best to buy it, but sometimes up to what the statistics say, 30% of patients, if they can't afford it, they either split their doses or skip doses and skip refills. So medications really only work if you take them. So sometimes it can be awfully expensive for patients to maintain a therapy. And that's one of the reasons that you're asking your pharmacist about this. We can try to help you with that.
So Brad, can patients assume that using their insurance card and paying their copay is always the best price for their medication?
There was a time where that was the simplest solution. You were lucky enough to have insurance through your employer or maybe through your retirement plan. But we're finding now and more that as insurance coverage gets more expensive and premiums go up, it isn't always your best price to assume that your prescription copay is your lowest out-of-pocket expense. So more and more, we're finding patients question what is the real cost of their prescription medications. And actually, it wasn't too long ago in Ohio that we actually, as pharmacists, were prevented from telling patients if they had a cheaper alternative for their copay or their out-of-pocket expense. And happily, the state of Ohio did pass a law where we are no longer refrained from sharing that information. It sounds kind of ridiculous, but there was actually language in contracts that we have with insurance companies that said we couldn't tell patients if there was a cheaper price. And happily, Ohio stepped in and they removed that gag clause from these contracts and made it illegal. So now all you have to do is walk into the pharmacy and say, hey, is there a better price for this medication I'm buying?
Well, I thought you always had to use your insurance card.
You know what? Yeah, it's actually it's the patient's right to be able to question and choose. Your insurance plans might beg to differ, but actually the patient is free to make the decision of whether or not they want to share their prescription information with their insurance plan. So if you have been frustrated by your particular plan, or you find out that maybe you come in the pharmacy and we talk to you and find out that your copay is, we had a situation yesterday in one pharmacy where a patient's copay was $141, but they asked us if there was a cheaper way to find their medication, and we were actually able to save them $20 off their prescription copay. So don't be afraid to ask. It's up to you, and you have the right to say, please don't put this prescription on my insurance card. But the key is you, the patient, have to be empowered to ask questions.
Okay. Give us a couple of examples on some of the potential savings.
So we have a new program that we are announcing today. It is called the Health Matters Drug Savings Program. And we've got about 150, 170 drugs on here that are commonly prescribed medications. It may be one that you might be able to save money by paying out of pocket versus using your insurance. And I have a couple examples. So, in the last week, we've been talking to some patients, and a patient came in and had a very common diabetes medication. It's called metformin. It comes in a couple different strengths, but this patient had a metformin 1,000 milligram prescription, and their 30-day supply copay was $5.75. And the patient asked us if they could save any money by, paying cash or getting a different quantity. And so we referenced our new program that we're getting ready to launch today. And for a 90-day supply, this patient would pay a $10 copay on our new plan. So instead of paying $5.75 every month for the next 3 months, which would be a total of $17.25, the patient can save $10 for a 90-day supply and save $7.25. And they'll also save 2 trips to the pharmacy and gas and time and other things like that. That's just one example. Another common example, many patients take a statin drug. One of the more common ones is Lipitor, or atorvastatin is the generic name. And it was a similar situation. A patient had a $9 copay for a 30-day supply. They asked us if there was a way that we could help them save money. On our plan, a 90-day supply, if they paid out of pocket, would be $10. So instead of paying $27 for a 3-month supply and making extra trips to the pharmacy, they could save $17 by getting a 90-day supply and paying cash up front. So it was 2 really good examples of how patients could just go ahead and say, hey, you never know. You don't get what you don't ask for, right? So don't be afraid to ask questions of your pharmacist.
Okay. So what do customers have to do? Do they have to present a coupon or a savings card to get these prices?
Well, that's one of the things that when we were putting this program together, we talked about, and we wanted to keep it simple. So, we have printouts in the pharmacy that you're welcome to come and get a copy of, but you don't have to log into a website and give away all your personal information. You don't have to have some little plastic card that you find in a magazine or at your doctor's office. You really just have to ask the pharmacist what the best price is on your medication. So it's super easy. You don't need a card. You don't need a membership program or anything like that. It's just asking questions if we can save you money. And, one of the things that I think patients are beginning to realize is that there is a lot of noise in the medication marketplace these days. You can't turn on the TV or the radio or even social media without seeing a bunch of advertisements about, oh, we're going to save you money. We're going to save you money. I challenge all you patients to think about this. How much money do you think Single Care and GoodRx and all these other programs are spending to get your information? They sell that information to other entities so that they can make money off of not only your prescription sale, but off of your demographics. So we're not into that. We've been around for 47 years in the Canton, Ohio, Stark County community. We're just your local pharmacist trying to help you save money and be healthy. So please keep in mind that with every gimmick, there does come a risk. And a lot of people are getting in trouble, especially at GoodRx. They've recently had the Federal Trade Commission pass down some rather stringent fines for not disclosing what they do with your patient's information.
Okay, so are there a lot of medications on this list or just a few like some of the stores post?
Well, we have over 150 medications at this time. And frankly, we're looking to try to grow that list as patients ask us more questions. One of the things that's really challenging in the marketplace right now is you may have visited your local pharmacy, or frankly, you may have visited your auto parts store or your grocery and found that there's a lot of things that supply chain has been a problem. So we're always looking for better prices for our patients because it helps us be competitive. Pharmacies like the Medicine Center are a healthcare resource to patients. We're the most accessible healthcare professional. You can come in and ask questions about all the problems you have. But one of the things that helps us also be an asset is to help you control your expenses. So if you've got a super expensive brand name drug that you just don't want to shell out a couple $100 for a month, maybe we can talk to your doctor and help you find something that's in another category generically that could save you money. So as we look to find more competitive prices, we'll expand this list and add more medications. But right now, there are medications in all the major disease states. We've got allergy medications, we've got diabetes medications, medications for your gastrointestinal or GI tract. There's men's health, there's women's health. So there's a nice variety. There's cardiovascular health. So we're trying really hard to make sure that there is something in every drug class to help patients if they're having challenges meeting those drug bills.
Okay, our first break's here. You're listening to Health Matters with the Medicine Center Pharmacy. Welcome back to Health Matters with the Medicine Center Pharmacy. It's not too late to get your flu shot. Stop into any Medicine Center Pharmacy today. No appointment necessary. We look forward to helping you stay healthy. So, Brad, what if somebody looks at our list and the medication's not on the list?
I would still encourage anyone to ask if we can help them find a better price. We do want to try to expand the list as best as we can as we are able to find suppliers that offer better pricing. But anything is possible. One of the neat things so far in our environment is if the patient asks us to help them find a better price on a medication, it's almost like a challenge. Maybe we can help find them a coupon card from a manufacturer. Maybe we can find another supplier that has a medication at a lower cost that we can buy. Or maybe, we had an example this last week, which was really unique. We had a patient that this is kind of a specific example, but I wanted to share it. We had a patient that had a prescription for a sertraline 200 milligram capsule. And sertraline is a popular medication that helps with patients that have depressed feelings or mood problems or trouble having a positive mood. And the 200 milligram capsule is a unique dose because it only is recently available generically. But for years, we have had sertraline tablets available at 50 and 100 milligrams. And it cost pennies on the dollar compared to this sertraline 200 milligram capsule, which costs us over $200 to buy. So we talked to the doctor and the patient, and we came to the conclusion that the patient could take 2 100 milligram tablets, and they were able to get that medication on our wellness list for less than $20 for 90 days. So it was really cool to be able to help them solve that problem. And the doctor didn't even realize that there was such a vast difference in the price. So keep in mind that when your doctor prescribes a medication to you, they're doing it with the best intent. They're trying to help meet a need that you have based on your particular condition. They don't always realize what some of these crazy drugs cost. It's one of those things that it's so random. I mean, on a daily basis, we see medications that cost anywhere from, $10 for a 90-day supply to $5,000 for a 1-month supply. It's really bizarre, the variety. So we just do encourage you to ask questions. You never know what the outcome could be. And our pharmacists can be very creative in helping finding solutions, even if it might mean we make what we call a therapeutic change and we talk to your doctor and help you find a solution that is with a different medication, but it can help treat the same condition.
Okay. What about this new deal on Amazon where you pay $5 a month for special drug prices?
It's interesting. I know that their goal is noble. I think that they've done an amazing job of getting the attention of all the media outlets, because there's a lot of talk these days with different, prescription drug is a hot button. And when Amazon announced this, it spread like wildfire. But, it's kind of not easy to learn how to use it. First off, you have to already be an Amazon Prime member, which costs almost $200 a year. And then you got to pay an extra $5 a month to get access to these special drug prices. So you're already looking at, almost $260 a year in expense before you even get to buy a drug. And then you have to, figure out how you're going to get your doctor to send a prescription to some pharmacy in some other state. And then you're going to have to hope they deliver it to you on time and deliver it correctly. So there's a lot of variables in there. And I think that's why we kind of are touting our own horn about all you have to do is call the pharmacy or walk in your local hometown, and we can help get you that prescription at a discounted price. And we're not going to charge you $260 annually for a membership fee to do it. And one of the nice things is too, if you need it, we do have free local delivery. We just have to schedule it up for you. So, if you call one of our pharmacies and you live near one of our pharmacies in Stark or Tuscarawas County, we can help work it out for you to get you a home delivery on our delivery schedule. So don't be afraid to ask questions about what you have right here in your own backyard.
Interesting. So what do you know about high deductible plans, and how can we help those customers?
This is a really good question. And this is one that we hear patients comment on a lot on a weekly basis. So high deductible plans, simply, it's a way for employers or companies to offer their staff members insurance. And it really offers kind of a cost sharing scenario. So these patients get the luxury of having catastrophic care, God forbid, if they have a car accident or need a surgery or have a health condition. But the crux of a high deductible plan is the patient initially shares more of the drug or medical expense. So in our area, our insurance agent tells us the most common high deductible plan deductible is about $3,000 out of pocket, which means the patient's going to be responsible for paying $3,000 in healthcare expenses before they are able to basically have a reduced copay or reduced fee. So we have patients that come in the pharmacy who sometimes, they are reluctant to go get their blood work tested because the lab might charge them a couple $100 to have like a cholesterol test done. And one of the nice things we've been able to do is we offer some tests in the pharmacy on the lab test side that help these patients with high deductible plans. So we've got a cholesterol lipid panel, which we charge $35 for, and you get your cholesterol, your total cholesterol, your LDL, HDL, and that gives you a nice list of medication result or lab test results that you can send to your doctor, and you don't have to spend a couple $100 at a lab to get that same test. So that's just one example of how we can help at the Medicine Center with patients that have a high deductible plan, but we can also help on the medication side. So a lot of these patients that have a high deductible plan, they're going to pay 100% of their prescription drug copay. And I mentioned earlier in the program, a patient rolled in with a metformin prescription, and their copay was $7 and I think 57 cents or something like that for a 30-day supply. Not a bad price, less than a cup of coffee a day if you're buying coffee out every day. But we were still able to save that patient money by them just buying 90-day supply at cash for $10, and they could save, almost $14 over the course of 3 months in prescription expense. So the thing about high deductible plans is you have to be able to pay attention to your expenses. If you're a young 20-something healthy person, it's great to have access to healthcare in the emergency case you need it. But maybe if you feel based on your condition, and it's a decision you as a patient have to make, if you don't expect yourself to have $3,000 in medical expenses this year, maybe it's okay that you pay out of pocket for your prescription drug or you pay out of pocket for your contact lenses, but those expenses won't go to your deductible. So you just have to keep in mind, if you're paying cash for something, it may not apply to your deductible unless your insurance company lets you turn it in. So be aware of that. But I mean, really, I think the best way at the pharmacy we can help you at the medicine center for a high deductible plan patient is one, don't be afraid to ask our pharmacists and staff questions about your medications. Can we help you find ones that are more cost effective for you? It's possible we can. We can also help you with some of the simple lab tests that people get on a yearly basis. I mentioned a lipid panel for cholesterol and heart health. There's also, for patients with diabetes, we can do a low-cost test for A1C, which is the hemoglobin A1C, and that's the test that is kind of the benchmark for diabetes management control. We can do vitamin D tests. We can do a thyroid TSH test. We have COVID tests. I mean, our pharmacists can even take your blood pressure too. So there's things that we could do in the pharmacy to help save you money. It's not always limited to drug costs. We can even help you do a medication review, and it's one of those things that might be able to save you hundreds and hundreds of dollars a year. So don't be afraid to ask us questions at the pharmacy.
Okay. Time for the news, I guess. You're listening to Health Matters with the Medicine Center Pharmacy on 1480 WHBC. Okay, we're back here listening to Health Matters, as our friend here said, with the Medicine Center Pharmacy. I am your host and pharmacist, Paul White. This morning, we're sharing our new drug savings program. Stop in and learn how to save on your prescriptions. We have a lot more to cover this morning, so let's get back to the show. Okay, Brad, what about our friends on Medicare? Can Medicare patients participate in our drug savings program?
Absolutely. Any patient, including Medicare patients, have the right to choose where they get services and how they get them. So any patient that's concerned about medication expenses, we invite them to ask questions about this program and see if we can help them save money on their prescription. I mean, the key is for the patient to ask questions. Some cases patients have a deductible, and Medicare patients are no different. If they pay cash for a prescription because they choose to do so, and we see this every year when patients get close to that donut hole, they get frustrated with their insurance plan and they want to see if they can save money rather than spending all that money to get them through the donut hole. And many patients, it can be a good idea. There are patients that have chronic medical conditions that end up getting through their donut hole earlier in the year, and it makes sense to them to get all their medications on their Medicare plan. But, if you're a patient that just takes one or two medications, or maybe you've got that one medication that gets you into the donut hole by, say, August, you may not ever get out of the donut hole the rest of the year. So it's in your best interest to ask questions to see if you can find medications cheaper than the copays you're going to pay for the rest of the year. So, if a patient has a deductible and they end up choosing a drug on our list that has 90-day supplies on it, and maybe it's $10 for 90 days, the risk is that it may save them money out of pocket, but that may not apply to their out-of-pocket deductible. So that's just a disclaimer that we need to share, but the patient has the right to do that if they want. And sometimes the patients don't always want to use their insurance, and we respect that. It's a free country, right?
Okay. Earlier, you mentioned diabetes, and there's a tremendous amount of folks that have diabetes in the U.S. I know we have several medications on our diabetes savings program, but what about diabetes testing supplies?
I'm glad you asked that. Yes, diabetes testing is important for daily maintenance. We mentioned that we do the lab test for the hemoglobin A1C in the pharmacy, and that is like a 3-month snapshot of what your blood glucose control looks like. But really, the best way for you to maintain your day-to-day blood sugar, especially if you're using an insulin or an injectable product, is to test daily. And, there's, again, lots of noise out there in the media. It may not be the most popular thing to prick your finger, but if you want to, pony up the cash and use the fancy iPhone over the sensor thing, you're welcome to do that. But we have a fabulous solution. It is called the Easy Max meter. And test strips, 100 test strips are only $18.64. So, the difference is that could last you, if you just test once a day, that's better than a 100-day supply. If you test 2 or 3 times a day, maybe that's a month's supply. But compared to spending $50, $60, $80, $100 for 1 month supply of these other fancy test strips, it really is a savings. So any patient that comes into our medicine center pharmacies that's newly diagnosed, we offer them a free Easy Max monitor and a free box of 50 test strips, and we give them a Lansing device too. So we kind of have our diabetes wellness pack, if you will, that we provide to the patient at no charge to get them started. The meter can talk in both English and Spanish. So if you want audible cues, you can get that too. It has a very nice big display. So if you're not one keen on looking at small numbers on a digital readout, these are nice and large and they're easy to see. You can prick your finger, you can prick an alternate site like your arm or your leg. So you're not restricted to fingers. It does require a finger stick, but for $9.32 for 50 test strips, it's very affordable. And it's something that a lot of patients really like because they get restricted into things on their insurance plan where their copays are often $10, $15, $20 a month for only a month's supply of test strips for the brand name type.
Why are we so much cheaper on strips compared to the brand name products?
We years ago found a solution where this Easy Max meter was actually designed by the same person that designed the glucometer. I guess we've just tried to help patients find a cheaper solution. We're able to buy them in bulk. We get a discounted price. We pass that discount on to the patient. And as a result, it's a win for the patient and a win for the pharmacy. I mean, it's one of those things that we've just been really fortunate to offer. And I think one of the things that we try to do as a small business in the community is work together with other small businesses and employers and try to help them find solutions for their patients and staff to make it more affordable to access healthcare. And this Easy Max meter is a terrific way to have better access to blood sugar monitoring so you can take care of your heart and kidneys and eyes and make sure that you're not having really high blood sugars because you can't afford to test and pay through the nose to get these expensive test strips.
One of the things that bothers me the most about these savings programs is that it encourages customers to keep looking for the lowest price, which may mean they have prescriptions filled at multiple pharmacies.
This is a concern, and it's been a concern of ours from the beginning of mail order pharmacy. Many health plans require patients to use mail order for different things, and we understand that, the PBMs tell their employers and their patients that that's the way they're going to save money. One of the things that this may be a segue, but I think it's important for our community to know, even our own insurance plan, we offer our staff because we are pharmacies. We wanted to have our staff fill their prescriptions with us and not have to use mail order. And the retort from the insurance company was, well, you can do that. That's fine, but we're going to raise your premiums a couple %. So, it's kind of one of those things where you're darned if you do, darned if you don't. But the important part about your question is it's important to keep your pharmacist and your doctor informed. If you're forced to use mail order for something, you need to tell us at the medicine center if you get medications filled with us that you don't get filled elsewhere. And it's important because you might have a drug interaction to that medication you're forced to get for mail order, and we don't know about it when your doctor calls in an antibiotic because you have a chronic health illness at the moment. So it's really important that we have the whole picture for you. And that's one of the things that I think sometimes patients are, concerned about their privacy, and we respect that. We don't share your information with anybody. We just use it to make the decision to help make sure you're getting what you need best at the time we fill your prescription or answer your questions about a concern. So all these discount plans and discount cards and things may have you going in 3 different directions. But, it's really important that you take the time to share with your pharmacist that, hey, I'm taking this, and this, and even over-the-counter medications. Sometimes calciums or vitamins and minerals could actually kind of butt up against some of the prescription medications you take. So please be mindful of that. You don't need to be embarrassed that you're Maybe you're taking CBD, or you're taking some supplement to improve your sex drive. It's important for us to know, because sometimes those things could affect blood pressure. It could affect other situations where you're going to be in a condition that you don't want to find yourself in if you're not transparent on what all you're taking at the same time.
Brad, I hear that this congratulations are in order for our new Philadelphia location and its staff.
Yes, we just recently went through the reaccreditation and recertifying process for our non-sterile compounding pharmacy lab in New Philadelphia. We have been a accredited compounding pharmacy through the Pharmacy Compounding Accreditation Board since 2009. And we're thrilled to have that recertified once again. It really sets us apart because there's only a handful of certified compounding pharmacies in the state of Ohio, and it provides a lot of confidence for our patients and our prescribers to know that we have a high quality process in place. And it's a lot of work, it's a lot of extra expense, and it's a lot of paperwork, but it's something that we're really proud of because it shows that we go above and beyond just being inspected and approved by the Board of Pharmacy. And it helps us really make sure that we're on our toes and providing a better product for our patients.
What about, can you explain to our listeners what compounding is and provide some examples?
That's a good point. Pharmacy years ago is really kind of the foundation was prescription compounding. If you ever see any antiques or anything, you'll see a lot of vials and jars with fancy Latin names on them and powders and things like that. In the beginning, even when you started in pharmacy, Dad, there weren't many prescription medications made by big drug companies like Lilly and Merck and Abbott. Now
wait a minute, I didn't start in 1800, okay?
No, but tell me how many prescriptions you had when you started pharmacy.
Oh gosh, nothing like today.
No.
Nothing like
so,
today,
we have thousands today. And so one of the things that compounding is neat is we can customize a solution to any patient. So if you think about, I don't know, it may not be a good analogy because of the supply chain, but if you buy a new car and you're lucky enough to order all the features you want, maybe you want a stick shift and you don't want automatic transmission, on like a Jeep, you can order that. We can customize your order based on your needs. Some common examples. So what we do is if we have a patient that has an allergy to red dye, or maybe they have an allergy to lactose, and they have a heart medication that they need to take on a daily basis, and the medications they've tried all have red dye or they have lactose in them as fillers, and it causes them a lot of gastrointestinal distress. Well, we can work with the provider and the doctor and the patient, and we can find a solution to remove those items. So what we do is we buy bulk chemicals from FDA-approved labs, and we are able to combine those ingredients in a way to help tailor them to the patient's need. So in this case, we would make a capsule that has a different filler in it. Maybe we use like a cellulose filler, and there's no red dye in it. There's no lactose. We just have the active drug ingredient, and we have a cellulose filler that's inert and doesn't upset the patient. They get a correct dose for their medication for their heart condition, and it eliminates all that other stuff that is causing them distress. And that's just one example. We can make a lot of different things. One of the nice solution is if the doctor wants to help a patient with a particular medication and they're having a delivery problem, we can help with the delivery problem. An example might be a hospice patient. So a hospice patient, sometimes when they are not well, they have trouble swallowing. We can provide topical medications that can be absorbed through the skin and into the bloodstream to help with nausea, to help with anxiety, and even help with pain. So a compounding pharmacy is kind of like, we have like a Swiss Army knife to help you solve medication problems. And we can do it in a way that you're not limited by what comes from a commercial manufacturer.
Interesting. Okay, Brad, time for our final break. You're listening to Health Matters with the Medicine Center Pharmacy. Welcome back to Health Matters with the Medicine Center Pharmacy. I'm your pharmacist, Paul White. Thanks for joining us. Let's get back to the last segment of our show. So How is a compounding pharmacy monitored, and how can our patients be confident that the product with the products that the Medicine Center Pharmacy is compounding and dispensing?
This is also an excellent question. So there are a number of different layers of both guidelines and regulations and accreditations that take place in pharmacy compounding in the United States today. So first and foremost, we're responsible to our Ohio State Board of Pharmacy, who is very active in monitoring pharmacies in the state of Ohio. We have, all the laws and regulations we have to follow for regular prescription dispensing, and then compounding has its own section of things we're accountable to. Most of the Ohio laws reference what we call USP 795. And USP 795 are the guidelines set forth by the U.S. Pharmacopoeia. And we basically are held to the standard that they devise for both quality assurance, cleanliness, potency, all of the things that are very important to ensure a product is safe, effective, and one that a patient will be able to benefit from. And now you take all of that with our state laws and USP, and then we at the Medicine Center Pharmacy elevate that to the next level, and we go out and we pay and go through the process of being part of an additional certification, which is by the ACHC. And that is the Pharmacy Compounding Accreditation Board survey. And that just basically is an opportunity where we open the pharmacy to the surveyors and the accreditation agency, and they come in and they check all of our processes, all of our quality assurance programs, everything we're doing to make sure we're not only meeting the State Board of Pharmacy requirements and also USP requirements, but taking that to another level to make sure that we can meet their standards that are over and above those two to meet the quality recommendations necessary for patient safety. So I feel like it's one of those things where, you drive by your average chain pharmacy or grocery store pharmacy, they're at one level, but we have to apply a whole nother level of time, expense, and attention to detail that patients don't really realize, but in the long run, it is in their best interest.
We may have already covered this, Brad, but how does compounding benefit a patient?
I think one of the ways compounding can benefit a patient is we can just meet your unique needs. We compound prescriptions every day for patients, men and women, for hormone replacement therapies, who are interested in maintaining optimal health and wellness. We are fortunate enough to be partners with physicians that work at Akron Children's Hospital to help patients that have pediatric needs, like it could be seizure disorders, it could be cardiac related issues or heart conditions. And these patients are often young enough they can't swallow tablets, so we can make custom suspensions and solutions for them. Even your pets. We've had the luxury of treating everything from dogs and cats to chickens to rats to hamsters, all kinds of different pets that require, drug companies don't make specific medications generally for a chicken or a rooster. And you can appreciate dogs can be anywhere from a 9 or 10 pound Chihuahua to a 90-pound Rottweiler. So all of these different things help us customize dosage and delivery forms to patients that have special needs.
So I understand that you compound for bioidentical hormone replacement therapy, and that our pharmacist Janice Marcinick, hey, do I pronounce that right? Janice is a certified BHRT specialist. Tell us what that means.
One of the things that we are very proud of is our hormone replacement therapy services, and a bioidentical hormone specialist, that the course that Janice has completed is one that's it's really important. On a daily basis, we get calls from providers and patients who are looking for solutions for their situation. Every woman at some point is going to transition through menopause, and that woman has a special need. Years ago, when I started pharmacy in the early 2000s, the most popular drug was Premarin. And every woman who was going through menopause got Premarin. I think there's maybe a handful of patients now that get Premarin. That drug has almost been removed from, the common prescribing habits because it doesn't meet the needs of all patients. The neat thing about the certification Janice Marciniak has in our New Philadelphia pharmacy is she has been trained in hormone replacement therapy and different ways to help coach patients and providers, help patients meet needs that they have that are unique. One patient may have a desire to enhance their sex drive, and another one might just have a desire to calm down the hot flashes. So those patients need different solutions. And that's one of the benefits of a certification and training that we go to. So, I don't think patients realize, but pharmacists do an enormous amount of continuing education. And this is one of those examples where we specialize in areas where patients have basically led us. We get a lot of questions about hormones and how can they feel better? How can I have more energy? I'm tired all the time. I can't get out of bed in the morning. And one of those things that we can help look at is not only their medication profile, but we can look at their hormone balancing and maybe even their nutritional profile and help them find solutions with their prescriber to meet those needs.
Okay, we're kind of getting tight on time here, Brad. What exactly does the term bioidentical hormone mean? And is hormone replacement therapy only for women?
Oh, okay. That's a good question. Well, building on my previous example of women in the early 2000s who took a lot of Premarin, that was a hormone that comes from horse urine. And that is a hormone that is not made in the human body. So when we say bioidentical, it's really a fancy way of saying the same hormone your body makes. So your body makes estradiol, it makes testosterone, it makes progesterone, and these are all hormones that your body synthesizes. And in the peak of your health, when you're growing up from puberty to childbearing age to going through menopause, all these hormone levels kind of fluctuate. So we're talking about putting hormones in your body in bioidentical hormone replacement therapy that your body made and just replacing the values that are missing. We're not talking about adding synthetic hormones that your body doesn't make, because sometimes there can be metabolism problems. And one of the metabolism problems allegedly with a Premarin that came from horse urine was that if a patient didn't have a healthy metabolism and a healthy system to metabolize that Premarin, they could have the risk of having higher carcinogenic byproducts. So, it's one of those things that's kind of a challenge that we manage, but bioidentical hormones is what the body used to make. So that's what we're trying to put back in it when the doctor orders it.
How about women-only therapy?
Yeah, women-only therapy, no. Men and women can benefit. Personally myself, I use hormone replacement therapy for men. Even as men age, our testosterone levels can decrease. So, if you see all the ads for low T, menopause for men is real. Okay. So don't be afraid to ask questions of your provider and pharmacist, but men and women can both benefit from hormone replacement therapy.
What about price on hormone replacement therapy? Is it expensive?
It kind of depends on what your doctor orders you. Patients, an average prescription copay for a compounded medication, if it's covered by insurance, isn't much different than a brand name medication. So, hormone replacement therapy prescriptions can range anywhere from, the low 20s to maybe the upper $60 or $70 for anywhere from 30 days to 3 months. So it kind of depends. But, on average, if you're going to Starbucks every day and buying a cup of coffee, your hormone replacement therapy is not that expensive on a daily basis.
Okay, interesting. Okay. How can a patient know if their doctor, tell their doctor or prescriber, or how do we know they're aware of compounding? I mean, they got so much to do in a day.
They do. Your prescribers are busy people and they have so much to be responsible for. Don't be afraid to ask questions about it. One of the great things we can do at the Medicine Center is we can help provide education to your provider. So if you have a question at the pharmacy about something you read about and you want to share it with your doctor, we might be able to give you a medical study that helps you show your point of view. And if your doctor isn't familiar with it, we can be available to answer questions for them. So, we're a healthcare resource, not only for patients, but for providers and doctors in the community. So by all means, providers can reach out to us anytime.
Wow. Okay, Brad. If our listeners want more information on either drug savings program or compounding, how do they reach you?
Well, if you're interested in our Health Matters Drug Savings Program, you can stop in our pharmacies starting Monday and we'll have handouts available, or you can just pick up the phone and call the pharmacy. You can send us an email through our website. It's really easy to find out information. Just reach out to us and we'll meet your need based on the needs that you've got. So we appreciate you.
Okay, doke. Thanks for listening to us today, folks. We hope you check out our new Medicine Center Drug Savings Program and let us help you save money. We would like to remind our listeners, if you suspect you have a medical issue, please contact your healthcare provider. Thanks to our sponsors, Altman Health Systems, Studio Arts and Glass, Genuine Appraisals and Liquidations. As always, we thank you, our listeners, for joining us on Health Matters with the Medicine Center Pharmacy. Have a healthy week. We'll see you again right here next Friday on News Talk 1480 WHBC.